Course, Level 4, Practitioner Protocols of Practice. We're now ready to begin Level 4, our last Level 2 certification. In Level 1, we cover the chemical to illnesses connection and the reason to reduce chemical exposure in our life. In Level 2, we were introduced to medicinal herb materials, their therapeutic properties, and health benefits, replacing chemically laced environments and products. It also provides options to the risky side effect of many synthetic medications. In Level 3, we provided product formulation proven effective in the plant-based CAM practice and showed the simplicity of plant-based product development and importance in better health. Now in Level 4, we bring it all together as a beneficial practice and view needed in today's health care and maintenance. Let's begin with a plant-based CAM consultation. We begin with a questionnaire assessment form that provides us a unique picture of the individual's health and health risk. As we continue to look at chemicals in the air we breathe, chemicals in the water beverage we drink, chemicals in the products and meds we use, and chemicals in the foods that we eat, and their connection with many of our illnesses. Remember, these are the areas seldom covered in the medical consultation, so they're not considered as possible causes. Before you begin to practice, it is recommended that you post the following information in a poster site on your wall or written on a page that your customer can sign acknowledging they have read and understand the information prior to the consultation. It says, important, please read. Our information is based on scientific validation, historical uses, anecdotal information, and common sense. Provided only for informational and educational purpose and should not be construed as medical advice. Always consult a qualified medical practitioner if ill or suffering from high or low blood pressure. The following is the plant-based CAM practitioner consultation assessment form. It has evolved side by side with the plant-based CAM practice. It is designed to aid the practitioner consultant cover topics of health importance. It is presented here in brief so the student can become familiar on the questionnaire and answers that take place during a PBCAM consultation. And most importantly, the basis for recommendation and blending of products. As part of the training, we recommend for you to answer the questions to see what changes, if any, you should be making in your lifetime. The perfect client for us is one that is up to date with their medical checkup, since we only offer guidance to those with a proper diagnosis for their illnesses. We do not want to promote for others to use us as their primary care. This will be unhealthy. Remember, we offer plant-based option and practice by looking at the science that is not looked at in a medical consultation, with an emphasis on the 4 steps to better health: chemicals in air, water, beverage, product, meds, and foods. This is what our practice and observation is based on. I must add here, before we get into the consultation, that to refer from doing third-party advices or consultation, you need to speak directly to the individual so the communication is clearly. We understand that third-party communication always you lose the meaning and some of the information on it. It could be not healthy for the third party that is not involved directly with you in the consultation. There's going to be, in few instances, I have had it myself, that somebody want to know what they can how they can help their cousin in another state, or they can help their brother in another state. Simply, we don't do that. They have to deal with us directly. So the consultation is for us to deal directly with an individual that is seeking our education or knowledge on those 4 areas that we have mentioned all throughout. In here, we have the 6 plans that NASA Plans for Clean Air, and you can go there and get the whole list, has selected to bring indoors, and they actually filter your chemicals in your home and give you oxygen. So we look at all these plants as additional air filters for indoor air. and these are the visuals of them. Most of us recognize many of them, and many of us have it in our home. So this is what we promote for an environment. Let's begin with a PBCAM assessment form. First is the general information: the name, contact telephone, address, city, state, zip, their gender, age, email, occupation, because we want to be aware of occupational hazards. So in a case where somebody was diagnosed with cancer, occupation is marine mechanic, he's exposed to diesel fuel, the connection is there. Diesel fuel exhaust is connected with cancer. So they can take this information to their doctor and then, of course, refer by. The reason for their visit and expected benefit. It is good to know upfront, what do they expect from you? What do they expect from this visit? Beginning blood pressure, this is optional. Some practitioners will take this. All is needed is a digital blood pressure equipment. If you want to get into this, you can. It is actually a checkpoint for healthcare. In times when I have done this, I was able to realize that some folks register high, and then the recommendation is to go, or low, and the recommendation was to go to the nearest fire station where they take your blood pressure free, just to double check before they go to the doctor. And in other cases, some folks that have been diagnosed with high blood pressure in their doctor's office read normal, and we do have white coat syndrome. So once again, once we settle on that and we see that there's a discrepancy, the recommendation is for them to stop by the fire station, the nearest fire station, and get their blood pressure taken, just to double check and take that information to their doctor. Remember, we are a checkpoint for healthcare. We're going to be covering areas, and we're going to be hearing things that they should be telling their doctors. Then we have pulse pressure. This is an area where few have knowledge of and few will check for. The pulse pressure tells us that if there is a difference between the top number of the blood pressure and the bottom number of 65 points or more, there is a risk of blockage in the artery. Now, we don't want to mention this to an individual. It's an option to do so. What I would usually do is tell them to let their doctors know that their pulse pressure is over 65, so they can double check it. Once again, a checkpoint for healthcare. And once again, the blood pressure monitoring is up to the individual practitioner if they want to get involved, and we're able to get involved in this. Then we have saliva pH. We talked about pH papers, and the reason we want to test saliva pH is because we want to be aware if the individual is acid or alkaline. We know that acid is a stage where many illnesses move in, and also cancer cells love that acid stage. They grow. And then the date check. Follow the saliva pH instructions, meaning that you take it 2 hours after a meal, or else it will definitely have an influence on the pH. And it's not written in stone. Saliva pH can fluctuate. And this is just another information that they can take to their doctor. And saliva pH papers is very easy to obtain from Amazon, for eBay, and they're very inexpensive. And this is a way to monitor themselves when they go home, just to keep awareness on their pH state. The other question is, are you presently under a doctor's care? You want to know. And the diagnosis, you want to know, so you can actually move in that direction and begin to ask your questions pertaining to that direction or what they're there to see you. Are you participating in any type of therapy? Yes or no? It could be a psychological therapy. It could be any therapy you want to know. Any allergies, food, medication, perfume, others. Here's where I'm looking for petrochemical diffusion. Um, in my years of working with pure essential oils, um, I have not seen any reaction to the essential oils. I have seen reaction to petrochemical, so-called essential oils, and of course perfumes and other synthetic chemicals in the air. I have seen or in the skin, but none on the uh, pure based essential oils that we recommend and that I use in this system for the past 28 years. Do you have a history of epilepsy, stress? Now, if they have a history of epilepsy, then I will omit using rosemary. Rosemary essential oils in the literature has been connected in the ability to trigger an epilepsy attack, so I will omit rosemary. And that's why we have it here. They have a history of stress. Who hasn't? Huh? A lack of energy, headaches. These are things that we can take care of with an essential oil. For stress, we have essential oils of ylang ylang. We have essential oils of orange, of lavender, and those we have mentioned in level 2. We also have from level 3 combinations, the de-stress blend, Synergy, which we use very successfully to uh, increase relaxation. The lack of energy, we go into the rosemary, peppermint, basil in the energy synergy. Headaches, we have a headache blend that once you put it together, you'll see that it takes care of headaches within seconds. Skin rashes, that we have seeded with Atlas. Asthma, well, we have cypress that open the upper respiratory passage. Uh, we have eucalyptus, which is excellent to use for anyone who has allergies. It actually relieves allergy very quickly. Insomnia, we have a tea mixture, the insomnia blend, and we have essential oils that have been connected and validated for insomnia. Dizziness, we have ginger in the root form. Also, we have rosemary essential oil, which is very effective for dizziness. Acid reflux, we have the acid reflux tea. Here's where the mints, the peppermints, and the anti-inflammatories go to work. So this is conditions that is known as stress related, but we do have uh, protocols set, and we have seen many of the essential oils and herbs work for these conditions, and they're very popular. So chances are the person will have one of this, two of this, or a few of this. Are you presently pregnant? If the answer is yes, then what we do is we eliminate direct contact with the skin with pure essential oils, and then we work on the environment. Based on the studies of the Red Cross that newborns are being born with 287 chemicals, we want to make sure this person that's pregnant is very aware of that, and then we're able to work on products. We can actually develop products with essential oils, so they're not putting chemicals in their skin and absorbed in their system. We can also guide them on how to make their own baby powder so they don't use talc products and so forth. And petrochemical fabrics for their babies. But the idea here, if they're presently pregnant, we definitely don't use essential oils by themselves in this individual because we don't know. It's an unknown of what would happen. So we don't want to do unknowns. But our work becomes very important for their environment and for the products that they are using. Are you personally breastfeeding? Uh, the statement underneath it says, pregnant or breastfeeding, we do not use essentials directly. We offer environmental assessment or replacement of toxic home and personal products for the same reasons. The next question is most favorite aroma, scent, or smell. This gives us a guide and can guide us to positive smell recognition and negative smell recognition. I used to ask a question when I worked at a psychotherapist's office on cases of depression and other cases of behavioral problems. And the question was, how did you feel about baby powder? Those who had an emotion about the smell, I would make a notation. I hate baby powder. It's okay not to like a smell. It's the difference to have an emotion attached to that dislike of that particular aroma. So I will make a notation, and later on, I was told by the doctor that yeah, 10 out of 10 were abused during childhood. So they connect the smell with that abuse, unknown to them because they were very small. But we began to connect memories and smell, and a smell um, it can bring up the feeling of a past situation, and they become negative aromas. So most of your favorite aroma, and we want to know that. For some, it's the smell of Christmas tree. Then we go to spruce essential oils. That's a relaxing oil for those who the smell of Christmas is relaxing. For others, the smell of Christmas is not their favorite aroma, and it's depressing for them for the same reasons that we covered before. Then the least favorite aroma, a guide to personal blending. We don't want to use those essential oils that are least favorite aroma to them. So that will guide us in what we blend. On the next column, we have date of last physical exam. We promote physical examination. We promote medical care. So we want them to know this. And if they haven't had a physical exam within the time that they should, this is a time to let them know that's a good idea, especially if they have a pain, if they have a feeling that they did not have before. Remember, we're the checkpoint for healthcare. But if they had a physical exam, we want to have their date on recorder, physician's name, physician address. This is option. Current medication is important. Prescription and non-prescription. Many don't think that non-prescription medication is a drug. It is a drug. In the past, any medication that has been prescribed for 10 years is able to go over the counter without prescription. So be alert on non-prescription medication. And then the next question is, do you have to maintain medication in your bloodstream? Before I answer that, let me go back to current medication. You also want to be sure that the side effect of those medications is not the reason that the person is actually coming to see you, such as a headache, such as a dizziness, and so forth. Do you have to maintain medication, a certain amount of medication in your bloodstream? If yes, then we omit the bath method. The German Commission E mentions that eucalyptus have to enzyme. We covered this in the level 2 that begin to detoxify the liver and take away the medication that needs to be in their bloodstream. But we omit all bath method with any essential oil if they have to maintain a certain amount of medication in the bloodstream. Then, of course, if yes, how often? You test it. If they have to maintain a certain amount of medication, they test it either daily, weekly, usually weekly or monthly. Are you aware of the side effect of your medication? Yes or no? If they say yes, you ask them, what are they? There's more times that they're not aware of their side effect of medication. It's very hard to even the doctors to be aware of many of the side effects of medication. If they look at the PDR, which is the physician's Bible for medications and side effect, just one medication could have about 6 pages of small print. So the best thing to do here is to go to the computer and Google their medication and side effects, or the reason that they're there. So once again, information that they can take back to their doctor. Do you exercise regularly? Yes or no? How many days per week do you exercise? And what type of exercise? The awareness come from the Dr. Koop, Surgeon General, and he was a Surgeon General a few years ago, and he did his studies on exercise and clearly showed that many of our illnesses will be reversed. Diabetes, heart problem, definitely circulation. if we exercise on a regular basis. So this is one thing that we promote. Not only we promote it, but we do it ourselves. Remember, you're a picture of what you are practicing. So the first thing you do with this concept is put it to practice in your own home, in your own health, so you can see an improvement in 30, 45 days. So you exercise for many reasons. I exercise for circulation. That is where I'm going to activate my circulation, and I can feel it if I don't exercise um, for a week. So on a weekly basis, where you do it once, twice, 3 times, it's good to do it 3 times a week. At least walk at whatever speed you want, 30 minutes 3 times a week, and you're going to see a difference because you're circulating, and that we need. And then you have a space for comments. Time frame. This is very important. We have talked about before that many of the health book, definitely natural health book, informs us of how wonderful this herb is, or how wonderful this oil is for this particular illness. But what I look for is a time frame. When? How many of this herb, how many tea of this herb or tinctures do I have to consume before I can see a result? So that we went out of our way to make sure that we share with you, so we can share with those who come before us. So, and also the time frame is under condition. You have headaches, okay? When did this begin? It began 5 years ago. We began to hunt. Okay, did you change homes 5 years ago? Did you tented your home for pesticide chemicals? 5 years ago, did you begin a new chemical service? 5 years ago, what happened? So we begin to hunt for within that time frame that it happened. And usually when you do that, you begin to look at the reasons. And in practice, I have. I mean, folks that have headaches for 7 years, and then we find out that 7 years ago they moved to a new home, and when they open windows, and they don't have a headache anymore. So many times, or they don't have asthma, or they don't have allergies, or So you look at time frame, and that will tell you a lot. Did you start taking new medication? We also look for this within that time frame, if that was a side effect. Did you use new insecticide soap, fragrance prior to this time? You heard me say in one of the videos the connection with soap, which was Irish Spring, and somebody that was diagnosed of arrhythmia. And in questioning time frame, she had arrhythmia a week and a half ago. That's when it began. And she went to the doctor, and the doctor prescribed, and she didn't want to take the prescription. Well, if you need a pill, you need a pill. But let's see the reason why. So we went to the questionnaire, and in all the questions, pesticide, fragrance, and so forth, she mentioned that, oh, my husband began to use this soap that I repel. I just don't like the smell. So I asked her to put it in a plastic bag and put it away. She just threw it away. And guess what happened? She didn't have arrhythmia. She had a reaction to that fragrance. So you begin to question, how many of us are on medication because of reaction of a smell? That's where we're going to be able to catch this. Remember, things that are not covered in the medical office. Did you move to a new location prior to this time? You want to ask those questions in time frame. Then we get into questioning the 4 areas of good health, the air that they breathe. Do you or anybody in your home experience any of the following symptoms breathing indoor air? At home, at work, headaches, dry cough, watery eyes, dizziness or nausea, dry or itchy skin, nose irritation, sensitivity to synthetic odors, fatigue, lack of energy, difficulty concentrating. These are the questions listed in the EPA questionnaire of sick building syndrome. The same. So we want to know if they have this. And then, we're going to look at the environment. Once again, open windows. Do you feel relief soon after leaving the building? This is another another information that will tell us. Let's look at the building. Have you informed your medical provider about this occurrence? Many times they don't, and many times they do, and because usually medical providers are not aware of this, they just go on to the next subject. So we want to make sure that if we catch any illnesses that is caused by indoor air, that they do tell their medical providers and they're getting informed. All they have to do is go to the EPA and hunt for Tuxtown, and you can do the same thing. Just Google Tuxtown. We mentioned it earlier in this program, and you're going to go to a page where you click different areas, and it tells you chemicals that you're exposed to on a daily basis and what they cause. Then we're going to ask him about a subject that not many of us know. It's that fine dust that is found on furniture in indoor air. So we're going to ask, is fine dust found on your furnishing? The answer is usually yes. We're looking for fiberglass insulation and recommending the AC vent filters for the protection from this well-known carcinogen, especially for that woman that is pregnant or just had a baby or they have children at home. They're being covered with this dust, which is a well-known carcinogen, and it's easy to fix just with an AC vent filter placed on the AC vent. We cover this in the first part in the air you breathe. How often do you air out your home? The EPA called it gassing off your home. Weekly, every 2 weeks, monthly, never. The recommendation is to do on a weekly basis, or every 2 weeks, or even monthly. Definitely when you're cleaning, if you're still using chemical cleanser to diffuse it as you clean. But a home that all the windows are open weekly is definitely a healthy home. Once again, every 2 weeks or monthly for some. Never is not a good one. Never is a concentration of chemicals, and guarantee that folks in that environment sooner or later will have insomnia, will have cough, will have headaches, things connected with indoor air, like the conditions that mentioned above. Next question: what health condition do you or your member or a member of your household have when waking up in the morning? This tells us what's in the air that they breathe. And then the next question is, how many years have you been working in the same building? How many years have you been living in your present home? This gives us a time frame on if they have any of the conditions when that began. Do you have a house pet? Yes. If yes, does it have a tumor? Now, this is now 2016, and if we go back 10 years, none of us heard of a dog or a cat with a tumor. It seems like we now have an abundance of that. We mentioned that on the chapter, The Air We Breathe. The same thing with thyroid problem. But we're talking about the pet, because the pet is the canary in the mine. It has been connected many times in my practice that I look at the pet, and if he has a tumor, that gives me an idea of the chemicals the rest of the occupants are exposed to. The pet is the first one to get it. And there's been a few times where the same cancer that a pet has, an occupant will have. So once again, remember, we're looking at things that were not around 30, 40 years ago, but now they're in abundance. And they're connected with chemical exposure. So it's good to look at the pet health, because that's the first one to get hit with any chemicals in the air. Then we have a place for comment. Let's look at now the water and the beverage that you drink. Do you drink or cook with tap water, filter water, or plastic water? Obviously, tap water you will have close to 700 chemicals that they need to put in that tap water, but you need to take out. One of them is fluoride, which is definitely a carcinogen. There's no doubt. There's enough science there to convince anyone. There has been science there to convince anyone since the 1940s that we mentioned when we covered this subject earlier in our program. But let's just go to the present time, and you don't want to drink tap water. Filter water is where you want to get involved with, and any filter water will be better than tap water. Plastic water is your vinyl chloride water. The plastic will dissolve in the water. Now, have you been diagnosed with acid reflux? Yes or no? Some people have, some people haven't, but many people do have acid reflux. And if they're drinking any sodas, chances are they do have acid reflux. So we cover that area. If you see somebody that drinks soda continuously, if they don't have acid reflux, they will. Do you drink beverage with a chemical ingredient list? Yes or no? We're talking about petrochemical drinks, sodas, juice that are really have an ingredient list. So it's any beverage that has an ingredient list. The ingredient list is chemicals. So if you want orange juice, come from an orange, not from a can, not from a bottle that when you turn it around, it has orange juice plus a few other things. And then we ask how many per day do you drink, and we advise them to go to the natural. Lemon juice doesn't come in a bottle; it comes in a lemon, and so forth. We're trying to begin to reduce anything with an ingredient list. We cannot do away with all 100%, and there's no need to, but it's okay to reduce, to begin to realize that those black beans in a can is really not black beans. It's black bean with an ingredient list, and so forth. And then if you want to have black beans in a can one day, that's okay. Have black beans in a can. But you don't have the rest of the products that you're using with ingredient list. You see, it's a cumulative damage that really gets us. So we want to reduce that accumulative damage in reducing ingredient list. Then the products that they use. It says check the synthetic chemical products we use daily. Many people are not aware of this. Personal care products, toothpaste. Once again, do you want to brush your teeth with a carcinogen? Deodorant, do you want to put carcinogens in your lymph nodes? Perfume, do you want to put petrochemical carcinogens in your skin, which goes in your bloodstream? Mouthwash, connected now with throat cancer, oral cancer. Body of food powder, remember the talc? And then others. We're able to replace all this. We did that in chapter 3. So we're able to replace this, or teach them how to replace this. Home use products, bleach, wood polish, towel cleaner, pesticide, room deodorizer, insecticide. Remember the 20 products that we took and we Googled material safety data sheet, and we find all kinds of chemicals and connected with all kinds of illnesses? That's the idea here. So you want to be able to replace this, or inform them on how they can replace it. Do you take medication for any of the following? Insomnia. We can replace that with a T without the side effect. Remember, side effect of insomnia medication is death, besides a few others. And by the way, it also causes insomnia. Muscle ache. There's enough in pain management right now, opiums, to pretty much want to substitute if it works, and it does, with the muscle ache synergies and tinctures, and also the tea, the herb tea. And we mentioned that sage is one of the main muscle relaxers in the herbs and the essential oil. Appetite control. We can do that with fennel in an inhaler. As a reflux, we mentioned that before. Easy to take care with a mint, with a peppermint. All this have synthetic medications that have side effects. Imagine somebody having insomnia and acid reflux and headaches. Now you're on 3 medications that have side effects, and we have mentioned before that the combination of the medication, there's no science there that tells us the predictable outcome, especially on 5 or more medications. There's no science that gives us a predictable outcome. So we're doing good if we're able to begin to replace and take care of folks that have headaches, or they smell a headache blend, no longer they have headaches. And if they open windows, of course, that's a benefit. And that's where our practice becomes very beneficial. And remember, you're practicing through education. Dissonance, the same way, stress and energy. We're able to take care of those areas with the essential oils. Cooking products. Do you cook with Teflon, pots and pans? Remember the Teflon fever, the Teflon, fever, the flu? And also Teflon carcinogen. Do you cook with Teflon cooking utensil? Carcinogen. You want to remove that. Do you or anyone in your family smoke? You want them aware of a smoke. You want them aware of secondhand smoke and the effects of third-hand smoke, which are all damaging to the family. I mean, in consultation, I remember a wife that says, my husband smokes, but he smokes in the kitchen. Well, they're sharing the air conditioning system. Even if they smoke in the car, you have the third-hand smoke, you have the second-hand smoke. So you want to bring a baby into a car that somebody smokes. You want to make them aware of this. The foods that you eat. Check the foods that you eat. Red meat, all cancers connected with red meat. It's out of the box. It is done. Turkey, chicken. We look at, and I used to look at animal meat, and with it has growth hormones, it has antibiotics, and that was my reason to slow down in eating them. Then I began to realize that, wait a minute, when we began to die, we began to turn acid. Our system began to go acid rapidly. That's why the first responders are trained to shoot us with sodium bicarbonate or baking soda, alkaline, to stop the process of decomposition. That's what's happening with an animal that dies. It is acid. So you're feeding acid, a piece of a dead animal that is in the state of decomposition, and that's what you're eating. And then, of course, you're feeding inflammation, and cancer cells love that. And once again, the connection with cancer and red meat is in the clear. This no one should doubt. Then we have white rice, white bread, white salt. All this, you feed high blood pressure. You feed the sugars will feed diabetes. Canned food, sugar, here we go, diabetes. In the salt, the best one for you to use is the Himalayan salt. As a matter of fact, you want to use that. We need salt. If we don't have salt, and those on low sodium diets could have dizzy spells. We need salt. We need sodium, but not white salt. So get yourself, and also promote. There's many types of salt, but the easy accessible for many is the Himalayan salt, and that you can have as salty as you want, because you're feeding minerals, you're feeding vitamins and so forth with Himalayan salt. Then we have processed meat. When I saw the research on processed meat that came about 2 years ago, I had to stand back and look at it again. Those who eat processed meat, which I was one of them, hot dogs, salami, Spam in my early years. Those who eat processed meat cut their lifespan by 40%. That's the research. So, we want to do away with processed meat. Salt substitutes, sugar substitutes, they're all connected with cancer. And then we talked about food with an ingredient list. Begin to slow down. We can never eliminate them. You begin to slow down. Are you constipated? Yes, no. Here's where kombucha, and we made a video on kombucha, which is our probiotic. Here's where it comes very handy. I haven't seen it not work on anyone with constipation within 2 to 3 days of taking 2 ounces in the daytime, 2 ounces at nighttime. So if you haven't seen the video for kombucha, definitely you want to view it as soon as you can, because you want to put this into practice not only for yourself, but have it available for those who come before you. And it's very simple to make. It's a great plant-based probiotic. There's another site which I mentioned before, which is in the list of approved suppliers from the site of the course, and it's the happyherbalist.com. You want to go to the happyherbalist.com, and that's a great kombucha place to get containers, to get babies. So you want to begin, and the babies are kombucha babies. They call it mushrooms, but it's actually a colony of live bacteria. We cover that in the video, so I'm going to let you see that video. How often do you drink a vegetable smoothie? Daily, weekly, once in a while? We recommend a daily vegetable smoothie, and that's where you're going to get your active vitamins. Because vitamins, plastic vitamins, even the AMA goes against them. It's dead. It's not live. It's a synthetic copy of the live vitamins. So when you make a smoothie with carrots, vitamin A, vitamin E, with celery, with apple pectin, with potassium from bananas, or a protein from kale. By the way, more protein than red meat you'll find in kale, and its absorption is faster than any red meat that sits in your system for quite a while. And so anyway, when this is what we recommend, and on a daily basis. If you have a health condition, cancer, diabetes, high blood pressure, rectal dysfunction, any of the muscle ache illnesses, inflammation, then we recommend 2 a day. And watch the food video if you haven't seen it, because that's where we cover this. We recommend 2 a day, and what we have seen, well, we covered that later on in this chapter in the case studies. So you want to do that twice a day, and in 45 days you're going to get the results. We'll talk a little more about it as we go into the case studies. Do you own a vegetable extractor, NutriBullet, Vitamix, Wolfgang Puck, or a commercial blender? You want to have one of this whenever you can. The NutriBullet is what I begin with, and it does cost about $100, $125, and it gets you really where you want to be in really breaking down the vegetables in liquid. The Vitamix is the best, but you're talking about $400, $500 that many of us don't have to invest. I began with a NutriBullet, and I end up with a Wolfgang Puck commercial blender, and I got that from the Home Shopping Network, which is about $165, sometimes $145, but they give you flex pay, so you pay $40 a month for X amount a month, and you don't even feel it, but you begin your health. This is one of the machines that you will need, one of those, because you need to have something that breaks down a leaf into juice, and a regular blender won't do that, so you need to have one of those. Incidentally, we begin our life as a baby with smoothies, and we realize later on that we need to move to smoothies again. It is amazing, and like I say, we will cover the in the later part of this chapter some of the cases and what we have seen. So if you do have one of those, if they do have one of those, if yes, how often do you use it? Daily, weekly, once in a while? What plant food do you eat daily? What plant food do you eat weekly? As you can see, we're moving to anti-inflammatories, and we're getting away from inflammation. And we're not talking a salad. We're talking about, and we're not talking a diet. We're talking about a different way of eating. And it's really neat, really exciting. There's a lot there that is very healthy, that we can actually provide for our bodies. And when we begin to eat anti-inflammatories, the health benefits are amazing. You will see results, like I say, from 30 to 45 days. You want to look in your area for a vegan group. A good place to do is in meetup.com. Now, in Miami, in Central Florida, uh, you're going to find Earth Safe. You heard me talking about it before. Earth Safe. They have meetings like twice a month in those areas. You might want to look at it in your area or any other vegan group. And this is where you begin to learn, you begin to taste, you begin to meet with people that had diabetes and no longer has it, to meet with people that had different illnesses and no longer has it, just like I did. And you begin to be aware of things that, okay, we can turn the page, we can actually change our health picture by changing the way that we eat. Once again, we look at it as how you're feeding an illness and how you can starve an illness. Feeding an illness would be eating inflammation food that is known to give us inflammation. Starving an illness is eating anti-inflammatory food. You go to plants when we're talking that way. So there's a lot to learn here, and it's a great learning process and very healthy. Confidentiality. This is where um, has this has been proven in court. So this is one of the legal things that we have. If applicable, can information in this questionnaire and session be shared with your physician or practitioner? Now, if they do not sign this or they do not check this, if they say no, and let's say their doctor calls us for information of what we did, we cannot discuss this case. If we do, we're breaking the law. If so, they have to sign yes in case their doctors want to know, and we keep information open, as you will see, of what we cover and the reason we cover. So once again, remember we have confidentiality in what we cover in the consultation, and that is a law. So that one we definitely want to obey, and don't give information about what took place in the individual consultation unless we are approved to do so by them. General information. PB-CAM sessions are provided only for informational and educational purpose and should not be construed as medical advice. We want that in the questionnaire. We want to be very clear on how we practice. Important for your health. Because communication between the client and their primary care physician is important, it is strongly advised that they inform their physician of any therapies complementary to their primary health care. Upon compliance with a statement, their physician may request information about PB-CAM concept and protocols of practice, and if they check the box in what we cover with their patient. Then we have cautions. They read it and they initial it. We want to make sure that they acknowledge that they are informed on the cautions of using essential oils. Keep out of reach of children, and they initial it. If under doctor's care, consult with him or her before using, and they initial it. Do not take internally by mouth unless directed by a medical doctor. Now, this is an issue that is being discussed right now, and definitely we're against taking essential oils internally. If we want to go internal with the benefits of an essential oil, which happens to be an herb, then we make a tea, like we mentioned prior in this chapter. The flavor of the tea is the essential oil, and then we go internal. If we want to go, we can also make a tincture and do the same thing, but we do not recommend or practice internal use of essential oils. That is practicing internal medicine. We're not trained for that. That belongs to a medical doctor. And they will sign that, by the way. So we're clear that they're clear on that subject. Keep out of contact with your eyes. Do not use during pregnancy or breastfeeding. We mentioned this before. If you have any adverse reaction, discontinue use. Always consult with a qualified medical practitioner if ill suffering from high or low blood pressure or an undiagnosed illness. Use essential oils blends by drop only and only as directed. Keep essential oils away from open flames and extreme heat. Do not use rosemary if you have high blood pressure because it brings the blood pressure up. Do use it if you have low blood pressure, by the way, but not if you have high blood pressure. Do not use ylang ylang if you have low blood pressure because we use it to bring blood pressure down. Do use it, ylang ylang, if you have high blood pressure, but do not use it if you have low blood pressure. Understand that. Do not use bath delivery method if you have to maintain a certain therapeutic blood level of medication in your blood system, and they initial it. The PBCAM assessment form should be maintained as a part of the practitioner consultative record. The client consultation summary form is the next page. It may be provided for the clients to take home. Let's look at that. Client consultation summary. So, their name, date, your name could be placed on top. By the way, you can take a copy of the questionnaire and a copy of this and use it in your practice, and you can place your information on the top of both copies, so this becomes personalized for you. The following are recommended synergies, blends, and instruction for use. Always be sure to use blends as directly. If you have any questions, please feel free to call us directly at, and then your phone number, contact number. And then let's say example, headaches. So the synergy will be the headache blend, recommended for as needed. How to use: put a drop in your fingertips, touch your each side of the temples, and touch your nose. Rub your hands together. Cup your fingers over the tip of your nose and inhale. And then the cost. And I do that with any blend. Or tea. Acid reflux tea, recommended for as needed, 2, 3, 4 times a day. How to use, and then how to make tea. 1 teaspoon per cup of hot steamy water. Wait 5 to 8 minutes and drink. Do not boil the material. And then the cost. Important notice. Please read. By the way, when you charge tax, you're not, you're pretty much showing that this is not medication because you're charging tax. That's optional. That's up to you, depending on how you set yourself business-wise. For that, you talk to an accountant. The important notice, please read. The FDA has stated, this is where we put the cards on the table. We want to be clear. The FDA has stated that there's not sufficient scientific evidence to support the claims of aromatherapy. The American Medical Association, AMA, classify aromatherapy as psychosomatic. According to research by the AMA, up to 87 to 90% of our illness are due to psychosomatic tendencies. That's what they say. That's what we use. The information provided is only for informational and educational purpose. Recommendations should not be construed as medical advice. Read methods of use and cautions before use. Because communication with your primary care physician is important, it is strongly advised that you inform him or her of any additional therapies you are involved in. Upon compliance with this statement, your physician may request information about the uses of aromas in therapy and human health. That will be the front page. I will place this on the second page, which is methods for use. Balneal bath, and it tells you to fill the bathtub with warm water and have 10 to 15 drops. All this can deviate, but the idea is to soak in for 20 to 30 minutes. For those who can't take a full bath, then you go to the foot bath. We covered this already in our material, so I'm just going to go and scroll through here. But this will be page 2 of the prior page that goes to the individual with the recommended blends. That will be page 1, and this will be page 2. Once again, you're welcome to copy this and make it your own. Change it around to what you will want to be. I'm going to see if I could put a different link where you can actually just download this form. So it'll be easier for you to move around and make it user-friendly. I don't think that you can rewrite on the manual, but I'm going to go ahead and put these forms in a format so you can move around. Because at the end is what you want, what you will want to customize. Um, you might be practicing, or massage therapy or Reiki healing or any other practice, and you might want to change the questionnaire around, put in some of your questions, some of the awareness, some of the things you want to know, and that's what this is all about. You adjust this to whatever practice that you're having right now. You're just adding the knowledge and the awareness of plant-based health. So we want to do that. So I'm going to go ahead and do that. You get a different section so you can download the forms and you can change it around to whatever is best for your practice. Let's see. Then we have the cautions again here and notes. We're going to stop right now before we go into the cancer beating the odds, and go ahead and absorb the information we have covered before, and we'll be back in a few minutes in our next recording, and we'll begin with cancer beating the odds, and also showing you a few case studies that we have observed during our practice. Stay tuned.